Hello, everyone. Welcome back to another session of A Day with your fertility specialist. I'm Joanna Damina, your host for today. And as always, we have another new topic coming at you. You've heard about fertility treatments, you've been wondering which one you should start on, and you've heard maybe about IUI and IVF, and you want to know which one is the best path for you or which one is the right path for you. Well, that's our topic for today. And guiding us through that is Dr. Deborah Olubi. Hello, ma.
Thank you,
Welcome
Joanna.
on set. It's been a while.
Yeah, it has. It's always
Yeah.
a pleasure to be here. Thank you
Mhm.
for having me.
It is.
Good afternoon, viewers.
Yeah. Good afternoon, everyone. Like we always say, and we do mean it, thank you very much for being here with us. Thank you for every like, every click, every comment, and every engagement that you share with us. It really means a lot to us. And we're happy knowing that we're helping you make more informed decisions out there. So, yes, if you're joining us for the first time, Dr. Deborah is a general physician, an IVF coordinator. She's the IVF coordinator here at ALPS, and she's a fertility specialist, which also took her to that stage. So we have someone here that has a lot of information and experience on this topic. So yes, Dr. Debbie, this is something that you deal with every day. It's a day-to-day
Yeah.
thing for you. But for people out there that wouldn't really know what this is, in a more simple term, would you be able to give us more information or describe better for us what IUI is versus IVF? I mean, in a way that anybody watching us out there can understand.
Okay, so they are all fertility options, like you
Okay.
said. So IUI just means intrauterine insemination.
Okay.
We know IVF is in vitro fertilization.
Mm-hmm.
So IVF is a more advanced treatment than IUI. What we do in IUI is that no sperm is deposited directly into the uterus.
Okay.
So you bypass the cervix, you deposit it around the time of ovulation. Usually you can do it with a woman's natural cycle, but sometimes we give drugs to stimulate ovulation in that woman before we give the drug. So the clients are usually monitored, and then around the period we determine that ovulation is going to occur. This woman is taken to the theater, and then sperm, her husband or partner brings sperm. This sperm is processed, concentrated, and then this sperm is deposited into the uterus with the aid of a very thin catheter.
Okay.
Yeah, so it bypasses the cervix. You are shortening the time for the sperm to move to meet the eggs for fertilization to occur in the woman's body.
Okay.
But in IVF, IVF is more advanced, like I said.
Yes.
It's a more prolonged process because it involves different stages. But with IVF, fertilization of the egg and the sperm is done in the lab. And then so the embryo is allowed to incubate in the lab. Then it's the embryo now that we transfer back to the woman, and then it's deposited in her uterus too, in the endometrium, for implantation to happen.
Okay.
So there are two different processes. Fertilization happens in the woman in an intrauterine insemination, but fertilization happens in the lab in IVF.
Oh, wow, that's very interesting. At some point you're doing the whole thing outside of the body, and then
Yes.
returning back an embryo into the woman's uterus, right? So these
Yes.
are very, very interesting differences. But why would somebody do IUI versus IVF? I mean, when you have clients coming to you, to see you, what will be the reasons why you suggest one or the other? If they choose,
Okay.
things like that.
Yeah, so a lot of things will help us determine which part will counsel clients to choose to go through, which is what we're discussing today. So a lot of information such as the age of the woman is very paramount. Yeah, because we know that a woman's fertility is fertility is optimized before the age of 35. Her ovarian reserve is better at that stage. She's likely to still be ovulating regularly at that stage. So for a younger woman, if there are no other issues, you might want to try an IUI first. But for a more older woman, a woman that is more advanced in age, an IVF might be the better way to go. But other medical histories will also help you to determine. For a woman that has bilateral tuber blockage or problems with the tubes, you can't do an IUI, because in an IUI you still need the tubes, because that's where the fertilization happens naturally, spontaneously in the body.
Okay.
The sperm will swim from the uterus where it's deposited into the fallopian tube. The egg is picked up by the fallopian tube, and then fertilization will happen in the tube. So for an IUI to be done, the tubes must be patent. At least one of the tube must be patent. So if a woman has blocked fallopian tube, definitely an IUI can be done in that scenario. So it must be an IVF. Then depending on the cause for the infertility or the difficulty in getting pregnant, if it's mild male infertility issues, that's mild low sperm count, mild motility or morphology problems with the sperm, you can still try an IUI. But if these problems are moderate to severe, then you can't do an IUI, because in an IUI you still need the sperm to swim. It's just that you're shortening the distance. Instead of the sperm swimming all the way from the vagina through the cervix, the sperms are deposited in the uterus. So you've eliminated the vagina, you've eliminated the cervix. So the sperm just swims into the tube. So if the sperms are, the sperm parameters are very poor, that the sperm is not able to do that, then you can't do an IUI. It has to be an IVF. That's one of the scenarios where an IVF will be what you will need to do. So other issues such as severe endometriosis, where a woman is not even producing eggs. So an IUI, the woman must be producing eggs, she must be ovulating, so an IVF will be, the way to go in that, in those scenarios. Then other scenarios too, where the couple want to do other things, like maybe genetic implantation testing to rule out aneuploidies, maybe to determine gender, or to rule out other inherited disorders that could manifest in the gametes. Yes, so an IVF will be the way to go, because it's only with IVF that you can do all those further advanced testings and so on. So an IVF will be the way to go in that scenario. And then, advanced age women, like I said, they're not producing eggs, you would have to do an IVF. Yes. And then if for mild problems with ovulation dysfunction, mild, yes, like PCOS that is mild, polycystic ovarian syndrome that is mild, an IUI could still be tried, because like I mentioned, sometimes you give drugs to stimulate ovulation, so that might just work. So an IUI can be tried in that scenario. But when you have complex, severe issues causing the infertility, and IVF will be the way to go. And then personal goals and choices also come into play. People might be younger, they might have patent tubes, but they say they want to get pregnant now and they want an IVF, because we know that success rates are higher with IVF than with IUI. So depending on people's personal goals and what they've determined for themselves, maybe the husband needs to travel outside the country, they're going to be away for some time, and they want to be sure that they get pregnant before that happens. So they might determine that an IVF might be the best way to go because of the success rate.
Wow, there's so many, factors that
so it's not just one factor. You just have to look at, everything to determine which is the right path for the client. And then in conjunction with the client, so you give the information, the client also, then makes an informed decision with the physician. You determine together which is the best way to go.
Okay.
Yes.
Well, you said you'd also kind of recommend an IUI for a woman that is younger and is probably still ovulating quite well.
Yes.
Things like that. For if that keeps happening, let's say you keep trying IUI and it doesn't succeed, and she's also getting older, does this affect the decision to either continue with IUI or actually move on to an IVF?
Yes, definitely. One of the reasons for an IVF is failed repeated IUIs. So even if the woman is still young, but you've done IUI, well, different people have different numbers. But if you've done an IUI 3-4 times and the woman is not getting pregnant, the only logical thing is to move up to having an IVF. It doesn't even have to be because she's getting older. This is not working, so you move to the more advanced one. So after someone has done an IUI for a couple of times and it has not worked, the next logical thing is to encourage them to have an IVF.
Okay, but is there a specific,
so people use different numbers. Some people say up to 6, but I don't think I would want someone to attempt up to 6 because, another difference between the two is that an IVF is definitely more expensive than IUI. But if you accumulate the cost of 6 IUIs, it might even be more than one IVF. So I in my own opinion, if you've had IUI 3, maximum about 4 times, I would counsel that, we move to an IVF.
You understand IVF. So,
Yes.
we have a better understanding of what IUI is now. You said you time it around the ovulation and you
Yes.
directly deposit
The
the
sperm.
sperm into
Yeah.
the uterus. But what about IVF? What does an IVF cycle look like? How does
Okay.
it,
Okay, so
differ?
IVF, like I said, is more is a bit,
Advanced,
yes, it's
yes.
more advanced. It takes longer. And IUI, the time for an IUI is shorter than the time for an IVF. So IVF involves various stages, because in an IVF you have to first of all take over the woman's menstrual cycle,
Okay.
so that whatever is happening in her body is happening due to the drugs that you're giving her from the outside. It's not due
Okay.
to what the body is secreting.
Yeah.
Yeah, so we have various stages. There's a stage where you want to do that. We call it the down regulation. And an IVF involves a lot of injections,
Okay.
so she's going to be on various kinds of injections. When you've done that, when you've taken over the her body system, you now give her drugs to stimulate the ovaries to produce a lot of eggs. In the natural menstrual cycle, the aim of the body is to produce one mature egg that is ovulated.
Yeah.
Is that it's in rare occurrences that you get two. Occasionally you get two eggs, mature eggs being produced and then ovulated. But in an IVF, you're stimulating her body to produce a lot of eggs. You want more than one egg.
Yeah.
You want quite a number of eggs, so that you can generate multiple embryos. So you give her injections to do that, and then after that, she's taken to the theater. When the follicles, which is what you measure, the eggs are mature,
Yeah.
you give her a drug to cause them to be released.
Okay.
And then you take her to the theater where the eggs are retrieved.
Mm.
So when these eggs are retrieved, then they are fertilized with the sperm. So her partner brings sperm, so they are fertilized with the sperm in the lab.
That's what you said.
Then the resultant embryo is allowed to mature for some time, and then she's taken back into the theater, and then an embryo transfer is done. The embryos are deposited into the uterus to allow for pregnancy to happen. So that's how the IVF process goes.
Okay.
Yes.
Well, I can see how, someone might want to keep trying IUI before
It's a
going
must.
into IVF. Like, sounds like so many steps.
In the
You're doing this,
IVF,
you're
yeah,
doing
but
that,
we're
you're doing
always there
that.
to guide the client. The
Yeah,
client doesn't need to cram or memorize anything.
exactly.
The fertility nurse, the doctors were always on ground to guide the
Oh,
client
that's very
through.
nice. Well,
Yes.
so if you've been following us, and we've spoken about some things that would encourage, or would have your doctor encourage you to go for an IUI first, or maybe just an IUI in general, and then to go for IVF. You're not alone in this procedure. You're not just going in and doing everything yourself. You actually have people to guide you. So don't be scared. I know when she said theater, I was immediately like,
It's an IVF theater. It's not it's a specialized theater for this procedure. So
okay,
it's
that's
not the
great.
normal usual theater.
Yeah, so in case you were worried out there, you don't really need to be. But IVF or fertility treatments in general are
Yeah.
quite emotional
Definitely.
processes.
Yeah.
Yes, you go through so many
Yeah.
emotions from
Yes.
this to that. How do you see your patients or your clients going through that with IUI as compared to IVF?
Yeah, I think for both, the emotions are there.
Wow.
Fertility treatments generally, the emotions are there. These are people hoping that this succeed. People that have been through periods of waiting,
Yeah.
periods of their hopes being dashed. Some might be frustrated, some might be going through family pressure. Societal pressure. Different things. So they come with a lot of anxiety about the process. So we
Yeah.
usually try to allay this anxiety. We try to explain the process to them. We encourage them to have a hopeful, positive attitude about the process. Yeah, when you have a positive attitude, it helps. So I think both for IVF and IUI, the emotions are there.
Okay.
Yeah. But we do our best to try to allay any negative emotions and encourage them to have a positive outlook to the treatment.
Okay.
And I think the information we give them, when they're well informed, this
Yeah.
also helps to allay some of this anxiety they have about the processes. Yes.
And you feel like you're involved in the treatment, and
Yes, when they know what to expect
exactly,
at
you're
whatever
carried
stage.
along.
Yeah, and they're
Yes.
carried along. They're told, the success rates, chances of success and all that. So they know that when all this information is given to them, it helps them to to go through the process more positively, with a
Yeah.
lot of with less anxiety, worries and all that.
Okay, that's interesting. Well, I mean, like I said, it's a very emotional process, but it's good
Yes.
to know that they're not being left alone. You have
No,
things
no,
to
they're not.
push you through, and then you have guidance when you go through that. But how do you say How important would you say it is that timing is regarding one of these two treatments? Like you mentioned earlier,
Okay.
somebody may be on crunch for time, maybe their spouse is going somewhere
Yeah.
else, and
Yeah.
things like that. How important would you say that is when it comes to your clients or your patients
Look,
choosing between IUI and
okay.
IVF?
Yeah. So definitely for people that are more advanced in age,
Hmm.
that the woman is more advanced in age, above the age of 35, we would definitely encourage that they have an IVF,
Yeah.
because we know that at about that age, ovarian reserve starts to decline,
Hmm.
and they need to quickly do something about their fertility, having a child, because
Exactly.
like we said, the woman's biological clock starts winding down.
Yeah.
Yeah, so for those kind of clients, time is of essence.
Mm-hmm.
We would encourage that they go straight ahead to having an IVF.
Okay.
And then some other clients have their own personal timelines for their lives,
Hmm.
goals and things they want
How
to
they want it
achieve.
to go,
Exactly, a
yes.
woman that wants to have all her children at so age,
Mm-hmm.
so that she can return to school or achieve something in her career.
Yeah.
So based on those decisions, we sit together. We might encourage an IVF for even a younger client, people
Hmm.
that live in different places. We have a lot of couples in this long distance marriages
Yeah.
nowadays. Yes,
Wow.
when time is of essence,
Mm-hmm.
the man might just be around for a few months or a few weeks in a
Yeah.
year.
Wow, that's very
So
short.
for those kind of clients, definitely an IVF.
Mm.
Yes, when timing is of essence, because we know that success rate is higher with an IVF. Definitely we might want to
We'll
counsel
cancel
that they
for
should have
that.
an IVF.
But is it an easy switch over? Let me see. Like you've tried IUI multiple times and it doesn't succeed, and you want to try
An
IVF. Is
IVF.
there anything in between, like a transition or
No,
anything,
it's
or you can
it's
just
just to plan again
okay?
with her menstrual cycle. So it's
Yeah.
an easy switch over. It's just to
Okay.
plan and educate her about how an IVF is different from an
From an
IUI.
IUI.
Yes, and
Mm.
what the process will entail.
Well, okay, well, we have Mercy Michael from Facebook, a comment on here. Thank you for joining. And I can tell that you joined a little bit late because we've spoken about this already, but let
Okay.
me just ask Dr. Debbie so she can give you an answer. She says, a woman with bilateral tubal blockage, can IUI be an option for her?
Okay.
Yeah,
So
so
we
you're
yeah.
joining us a little bit
Yeah,
late,
so we
but
spoke
let
about
her
that.
do
So
that.
with
Mhm.
bilateral tuber blockage, an IUI cannot be an option,
Yeah.
because in IUI you still need the sperm to swim into the fallopian tubes,
Mm-hmm.
and you need the eggs to come into the fallopian tube, because that's where the fertilization takes place. So if
Yeah.
the tubes are blocked, there's no way for the egg and the sperm to still meet. Like we said, an IUI just bypasses the cervix. You drop the sperm into the
To
uterus. So
uterus.
IUI is also important for people that have cervical mucus issues. There's some people
Mm.
that have that might be the reason for why they're not getting pregnant. When the
Okay.
mucus is hostile, the
Okay.
cervical mucus is hostile to the sperm. So an
Mm.
IUI helps to bypass the cervix. So
Oh,
for
okay, I
those kind of
see.
candidates too,
Yeah.
IUI might be a good choice. So for bilateral tuber blockage, it must be an IVF.
Okay, so
Yes.
Mercy, I hope that answers your question. Thank you for sticking with us and thank you for joining. Although we've gone quite far. So if you're sticking with us or if you're joining us a little bit late, don't worry. We have all our sessions still on our platforms. You can go back and rewatch them. And if you have any more questions, please don't hesitate to leave them in our comment sections, or for the next live session, you can always still ask your questions. So but for success rates, I know you
Yeah.
chipped in a little bit about success rates as we're going. How would you say is the difference between IUI and IVF, especially
Yes.
in relations to different age groups that try both cycles?
Okay, so for women that are younger, less than
Mm,
35, success rate for IUI is between 10 to 20%.
okay.
For an IVF, between 35 to 50%. So you can see
Mm,
for an IVF, success rate
it's
per
marginally
cycle is
higher.
higher.
Yeah.
Yes. So because with an IVF is like a more precise science. You've
Mm,
taken out a lot of the barriers. So now what you're looking at is quality of embryos generated,
mm-hmm,
dropping them on the endometrium. But with an
mm-hmm.
IUI, like we mentioned, the sperm will still need to swim into the
Exactly.
fallopian tube. The egg will also still need to be picked up. The fertilization, then for it to swim back to be implanted.
Wow.
So success rate is higher with
Mm-hmm.
IVF.
Okay, yeah,
Yes.
that's interesting. I mean, of course, you already said it's an advanced fertility treatment, so
Yes. Yes.
definitely I would expect the success rates to be a little bit higher. But when your clients come in, is there anything you notice that they some, let me say, premonitions they have about IVF and IUI, like thinking one is a simpler option, or one is quicker, or one is easier.
I think what they know is, for most clients, they know that IUI is cheaper
Mm,
than having an IVF.
yeah.
Well, and then a lot of clients assume that IVF is 100% success rate,
Oh,
which
exactly.
unfortunately it's not.
Mm,
So I think those are majority of the assumptions. People just
yeah.
come when when we tell them they have to have an IVF,
They think.
or they come on their own and say they want to have an IVF. They
Mm,
just assume it's 100%. So those
mm-hmm.
are part of the education we do.
You do.
Yes, let them we help them to understand how the process works,
Yeah.
and the fact that it's not
It's not
a
a hundred
100%.
percent.
Yes.
Okay, well, that's interesting, because I've actually heard, people say, this is happening, just go and do IVF, just go and do IVF, like
Yeah,
it's some sort of miracle. Okay, we have.
it's still a miracle. IVF is
Sorry,
still,
I was
thank
going to
God
say
for.
magic.
Okay,
It's a
magic.
miracle,
Yeah.
yes, it's a miracle. It's not
Thank God,
magic.
if
It's
if there
science.
was no IVF, a lot of couples or families would
Yeah,
not have the opportunity of having their own
that they
children.
do
Yes,
today.
IVF is a wonderful science,
It is.
that's helped to, bring smiles and joy to a lot of families.
Yeah,
Yeah.
I can tell you're really excited talking about it. And thank you so much, guys, for the engagement today. We have Patience Nuhu from Facebook as well. And she asked, can someone with hormonal imbalance go for IVF?
Definitely, definitely,
Mm-hmm.
yes. Polycystic ovary syndrome
It's a
involves a lot
hormonal.
of hormonal imbalance,
Yeah.
yes. So she just needs to come be evaluated. Before the process, we try to correct as much of the hormonal imbalances as we can,
Mm-hmm.
and then we counsel her on the best way. Yes, someone with hormonal imbalance can
Can
go for
go
an
for
IVF.
IVF. Okay, well, Patience, I hope that also answers your questions. We're really glad that you're asking, and we're really glad that you're joining us today. But unfortunately, we're coming to the end of it. So if you have any more questions, it's time to ask it now before Dr. Debbie finishes up with us here. So, just as a on a final note, what advice would you give to your couples or women, generally anyone that comes into your office and is just overwhelmed trying to figure out
Mm.
what is the right path for them? What
To-
would you
yeah.
really do to tell them to just
Yeah,
keep them
so
a bit
I'll just tell
assured?
them to be open to the counsel their fertility specialist gives them. Be
Yeah.
open to doing all the evaluations required,
Mm-hmm.
and whatever procedures they ask them to do. Just be open to the counsel. I'm sure they will break it down, to the simple language they can understand.
Yeah.
Just be open to the counsel you're giving, and go along with the counsel that you're giving. And if you do, I know that achieving your fertility dream is just a step away.
Oh,
So that's
that's
just my
nice.
counsel. Be open. A lot
Yeah.
of people come and they have preconceived ideas,
Exactly.
notions, and some of them, they have some stereotypes that are really very hard to break. And
Mm-hmm.
even when you're sharing what you think is the best part for them, they
Yeah.
already have something in their mind that they
That's just
want
rejecting it.
exactly. They just want to go with it. So
Mm-hmm.
I think having an open mind as you come for this evaluation is very important, and
Okay.
being open to the counsels you're given,
That's good.
it's
Yeah.
important too.
Well, I mean, for you already even coming in the first place, that's a
Yes,
huge first step to take.
it
And
is.
you've
Yes.
already made yourself available to this information that you're going to get. So it's best for you to, keep your mind open
Yeah.
and try to think about how this would help you to achieve your dreams of, your fertility journey and your fertility treatment. So let's see if we have anything else before we go. Oh, okay. Nkechi Esther from Facebook. Wow, Dr. Debbie, you're really getting a lot of engagement today. She says, is it possible to test positive on day 8 after embryo transfer? Now, this sounds like somebody that has
Someone that had an embryo
an
transfer.
embryo transfer.
Well, usually for most people, testing after embryo transfer will usually cancel from around day 10.
Mhm.
Yes, it's not impossible to test positive on day 8, but if the test comes negative, it doesn't also mean it's going to be negative at the end. So we don't
Yeah.
want to increase anxiety and build up.
Okay, okay.
Yeah, so we would say wait till day 10, wait till day 11
Mhm.
before you test.
Okay.
Yeah, but the test can be slightly positive. It depends on the kind of test you're doing anyway,
Okay.
how sensitive the pregnancy test you're doing it is.
Mm.
But it could be positive on day 8, but that's not the usual day we advise you to test.
Okay.
Usually say wait for at least day 12.
Okay.
In our center, we usually want to wait for at least day 12, between day 12 to 13
Mm.
to test, so that whatever we get, we know that's the definitive result.
Yeah.
We're not telling you, let's still wait, let's
Wait
still
and
wait.
then do
Yeah,
another one again.
exactly.
Okay, well, like we said earlier, if you have been with us, your fertility journeys are quite emotionally tasking and overwhelming. So yes, like she said, it's possible. However,
That's not the
that,
norm.
yeah, it's not the
Yeah,
norm.
some
And
clients have said they'll show you the strip faintly positive, but
yeah,
we test from between day 12 to 14.
14. Okay, that's great. So, just try to follow as much as you can with what your healthcare providers are doing for you, your fertility specialist, your doctors, your nurses,
I know a lot of
whoever
them are
it is.
anxious and they want to start
Exactly.
testing.
Just follow with that, they're
Yeah,
also looking out for you. They're
yeah,
trying to reduce that anxiety that you
exactly.
have, and you're trying to test from day
So you
one
test on day
every
8 and it's
day.
negative. What does that say?
Exactly.
It doesn't mean it's
It doesn't mean
negative.
it's fully negative. You might test again day 12, day
Yeah,
13, and it's positive. So just
it's
look
quite
out for
early at day 8.
yourself. Yeah,
Yeah.
it's quite early. Look out for yourself and try to work with your team, when you're going through fertility treatment. So thank you so much, Dr. Debbie. We
Thank you.
have seen, the differences between IUI and an IVF, and why somebody might be recommended to, try IUI or try IVF, or do one of the other first. But it's been a very interesting session today.
Yeah.
Thank you so much for joining us once again. Like I said, it's
Thank
been
you.
a while. It's lovely to have you
Thank you for having me,
today.
Joanna.
Yes, ma. Okay, everyone. So this brings us to the end of today's session. Like I always say, we're here to just help you get more knowledgeable about your options, and so you can make better choices. It's lovely to have you today. We go live every Wednesdays and Fridays on Instagram, Facebook, and YouTube, sometimes TikTok. So find out and stick around for that. You can follow us and turn on your post notifications so that you'll be reminded every time we have a post coming up. And for that fertility treatment or journey that you've been thinking of going off, this is a shameless plug. You can always walk into our book a session. Just talk to somebody today. You never know who might be that person that could be able to help you. So, yes, thank you so much for joining us. I will see you next time I'm on here. Bye. Have a lovely day.